They have a lot of strain on their upper body. They're treading water and having to still throw with force with their shoulders. So we see a lot of shoulder injuries, overuse shoulder injuries, as well as acute injuries, dislocations. It's a unique sport, overuse with their legs as well because they're constantly treading water. And then, acute injuries, trauma from being kicked under the water, those types of injuries can occur with water polo. So acute dislocations, it varies on the body part. So there are certain dislocations that can occur where you pop it back in place and you can comfortably let the athlete return. One that comes to mind, finger dislocations. If you're, as long as you're not concerned there's an underlying fracture, you can pop the finger back in place and buddy tape and they can safely return. When you get into some of the bigger joints, shoulders, elbows, those, with the trauma to dislocate the joint oftentimes injures a lot of the supporting structures. And that's one, instance where, again, you weigh the risks and benefits and likely, due to pain and disability, they're not going to be able to protect themselves. And so in those cases, unfortunately, we have to remove them for the time being.